will speak about the hoof of the horse and ruminants. And of course, it is very important specifically for equine. And we spoke before about the bone which forms the skeleton of the hoof. And we mentioned that we have P3, this one, the third phalanx. We have P2, but does P2 completely inside the hoof? Only half of it. In addition to this bone, which is the navicular bone. Navicular, which means canoe-shaped, or like the boat. And this bone, this small bone, makes a very big disease. It's called navicular disease. And it articulates with P3. This bone, it has a specific area. Here, this flat part. It will articulate with another flat part here, articular part, with P3 like this. Like this, okay? And here, so the navicular bone will have a proximal border and a distal border. The distal border articulate, and it will have two surfaces. One dorsal and one palmar or plantar, where my finger is pointing. This one, where the DDF will is located, the deep digital flexor tendon. So these are the parts inside the hoof. These two and half, or the distal part of P2. Also, I'd like to mention that this is the palmar processes or plantar processes of P3. The P3, this is the extensor process of P3, and this is the solar border of P3, and these are the palmar or plantar processes, and this is the articular surface. We can see that a lot of foramina present on this surface. This is called the parietal surface because this is adhering to the wall of the hoof. And this is the solar surface. This, what faces the ground, is called the solar surface of the third phalanx. This solar surface is divided by this line, which is called semilunar line. And we can see two foramina located here. If the camera can zoom in, we can see there is a foramen here and another foramen. These are called solar foramina. There is a solar groove. Each solar groove will lead to a solar foramen, and these two foramina are connected together by a canal inside the bone called solar canal. If you remember, each digit has a medial palmar digital artery, vein and nerve, and lateral palmar digital artery, vein and nerve, or medial plantar vein and lateral plantar vein. The vein and the artery will run through this solar canal, and they will anastomose the medial and lateral arteries, and they will form an arch called terminal arch. From this terminal arch, branches will radiate to supply the digit. Okay? That's why this looks like a pumice stone, this P3. Above this part, above these palmar processes or plantar processes, we will have the collateral cartilages. I think this one is from a pelvic limb because it is pointed. If it is thoracic limb, this will be more rounded. Okay? So the collateral cartilages we will start to see here in this cross section of the foot. This whitish part is the collateral cartilage, and this is collateral cartilage or angular cartilage. Can you see these blood vessels on either side of this collateral cartilage? A lot of venous plexuses on the abaxial surface and on the axial surface of the collateral cartilage. And there is a soft tissue here. This is called the digital cushion. This part is the digital cushion, and this soft tissue is located dorsal to this part. This triangular part is the frog. So what is above the frog? is the distal cushion. What is above the distal cushion is the DDF. What is the DDF? Is the deep distal flexor tendon. This is the deep distal flexor tendon. It ends in B3 by two lobes, two parts. But all of it is the deep distal flexor tendon. Okay? So when the frog, which is soft, normally the frog doesn't touch the ground. On normal ground, not a muddy ground, the frog does not touch the ground. The weight is carried by this border. This is the solar border of the foot. This carries the weight. When the animal puts weight during galloping or trotting, this frog, which is soft, will touch the ground and will convey the concussion into the distal cushion. And this distal cushion now expand because it is soft. And when it expands, it will compress these collateral cartilages. And once they compress and expand, they will squeeze the blood vessels on the axial and abaxial, on the axial and abaxial. These venous plexuses will be squeezed and the blood will move upward or proximally. Okay? So this distal cushion acts as a heart for the hoof. Okay? Let us speak about the hoof wall. We mentioned that the hoof is a modified skin. So here we have the skin. Until when the skin ends at this transitional zone, this junction, this is the coronary band. This area is the coronary band or coronet. Okay? Then we have the hoof wall. All of this, the hoof wall. The hoof wall is formed of 3 layers. The first layer, which is this part, I'm putting this probe inside. This is the stratum externum. This is stratum externum or preople. This part is the stratum externum or preople. This is the waxy material. Close to the hair you will feel waxy material or oily material. This is the stratum externum or preople. And it doesn't extend to the ground. It does not. It ends here and it protects, and it is like a varnish to cover the hoof and act as a barrier for water, to prevent excess water out or excess water in. This is the stratum externum or preople. This preople will enlarge palmarly or plantarly to form what is known as the bulb of the heel. This area is called the bulb of the heel. It is made by the preople. Bulb of the heel is a projecting part, but sharing its formation is the preople. Okay? Let us back to the wall. What is the second layer of the wall of the hoof capsule? The second layer is the stratum medium. This part is the stratum medium, the thickest part. Okay, so the preople is above, and what is this? This is the stratum medium. You can feel lines here. These are the horny tubules. It looks like hair. Okay, but you should know that it is a spiral. It is a spiral to absorb concussion. This stratum medium, if we look in sagittal section, like this one, this is the stratum medium. In sagittal section, you can find, or you can see that it has pigmented part and non-pigmented part. This whitish part, this is the non-pigmented portion of the stratum medium. If I look here, okay, oh, this is the pigmented part, this is the wall. This is whitish part, this is the white line. This is wrong. This is not the white line. This whitish part is still stratum medium. Where is the white line? The white line is the junction between the sole and the wall. So here, where the sole ends, the white line starts. Okay? Back to the stratum medium, this part with its 2 portions, the pigmented and the non-pigmented. This stratum medium is followed by stratum internum. This stratum internum we cannot see very well. Let us see if we can show it to you. in other specimens. Again, this is stratum externum, and this part is the stratum internum or epidermal laminae. Can you see? The camera can get close to see these layers, these pages. You see these lines, these curtains, like pages of a book, about 600 in number. These are primary epidermal laminae. They are named stratum internum or epidermal laminae or horny laminae. Okay? Each lamina of these carry secondary laminae. So if they are 600 in number, and each single lamina of these 600 carry about 165 secondary laminae. So the total of these laminae will make about 1 cubic meter. Okay? So this huge space in this confined area will interdigitate with the dermis, which is called the laminar dermis, as you will see. So these are the three layers of the stratum, stratum externum and medium, and the stratum internum. If we look to the wall from inside here, we find that the wall has very narrow groove above. It is not clear. It is about 1 millimeter. Okay, here. This is called the periubellic groove. Next to it, we will find a thicker groove or bigger groove where my finger can run. This is called the coronary groove. Coronary groove. And this is the stratum internum. In between, we have these spaces where the laminar corium will interdigitate. This is for the hoof wall. The hoof wall, when it extends like this, it will go caudally and reflect on the solar surface here as what is known as the bar. This part is called the bar. So the hoof wall is formed by toe. This is called the toe, which is the thickest part. Then the quarter are the sides. Then caudally, this is the heel, where my fingers are located. The heel is ventral. Dorsally, this part is called the bulb of the heel. So this is bulb of the heel, and this is the heel itself. Okay? The wall and the heel on the solar surface will continue to form the bar. Will continue to form the bar. The angle where the wall converts into a bar, there is an angle here. This is called the angle of the wall. This is the angle of the wall. This is where some stones or stuff can be lodged here. It's called the corn. Okay? This is the angle of the wall. Then we have the sole. All of this is the sole. The sole has central part and these two angles of the sole. And the sole is separated from the wall by the white line. It doesn't look white. Yes, it doesn't look white. But this is the white line. And the sole is separated from this part, which is called the frog, by these two grooves. We name them either collateral grooves or paraconial grooves. Both grooves, both names are acceptable. Either collateral grooves or paraconial grooves. And this is the central groove of the frog. The frog, as you can see, has an apex and has a base. Okay? This base will share information of the bulb of the heel. This is the bulb of the heel. Correct? This central sulcus or this central groove will project to inside the hoof as frog spine or frog's tail. This is the frog spine. So I have a groove here, it will project inside into as frog's tail or frog spine. Okay? And all of these laminae are the stratum internum. All of these laminae are stratum internum. How this hoof wall is formed? How this hoof wall is formed? How the frog is formed? Is produced because it erodes by the surface and friction, it erodes or by trimming. So how it grow? Who produce the frog? Who produce the stratum medium? Who produce the preopel? And who produce the frog? And where it is located, this part which produce these structures, where it is located? The parts which produce this horny material are the corium. Where they are located? They are located in specific regions. For example, the part which will form the frog, this is not the hoof. This is the inner. This is the corium. This was like this. Okay? So this is the dermis. This is what produces this. If this is the positive, this is the negative. Okay? They keep here. So what I want to show you that this frog corium, which has papillae, will form this frog. Okay, it is above it, it will produce or develop the frog. And this solar corium, which is papillated, will produce the sole. Okay, will nourish the stratum germinativum of the epidermis to form the sole. Then we have here, what about the stratum medium? I wanted to know what forms the stratum medium, the main part, which carries the weight. The stratum medium is formed by something called coronary corium. This is called the coronary corium. All of these are papillae. This is the coronary corium. Where it is located, there is a specific groove here. It's called coronary groove. It is called the coronary groove, where the coronary corium will be located. Okay? And in this coronary groove, we have holes. Through these holes, these papillae will extend to form the stratum medium. Okay? In addition, above the coronary corium, we have periopelic corium, very narrow, to produce the thin layer, which is the preopel. Let me wear gloves and get back to the fresh specimens. So here, this is the stratum. Which stratum is this one? Medium. This is the thickest part. Why it is colored two parts? Because it is pigmented and non-pigmented, and so on. Okay. What is next to it? Here, if the camera can get close. Now I want you to notice this part is the coronary corium. All of these are papillae. And above it is the periopelic corium. The camera will get close. I want you to see the papillae. Can you see the papillae? Can you see this papillae? Look. If the camera can get close, I will take them off. Look here. These papillae carry artery and vein. And they will enter into these holes to form the tubular horny material and the intertubular horny material. And these tubules are spiral. Okay? So all of these are the periopelic corium, and this is the coronary corium. The periopelic corium will produce the periopel. This is the periopel. This is the periopel. Okay? And what about the coronary corium? What it is going to produce? The coronary corium will produce the stratum and nourish the stratum medium. Okay? And what about this corium? This is the laminar corium. What does it produce? What does it nourish? Does it produce horny material? No. It interdigitates with this laminae. Can you see this laminae? This is the epidermal laminae. This is the stratum internum. Okay, this is the horny lamini. This is really horny in life. This is hard. And this one, this soft lamini, this dermal corium or laminar corium, okay? This laminar corium interdigitate between these curtains, okay? Interdigitate between these curtains. So this coria, I mean the laminar corium and the stratum internum, when they interdigitate like this, if this is blood vessels, filled with blood vessels and nerves. So if there is increase in the blood vessels, okay, and gets in between these walls, these are rigid, and these arteries and veins in between from the laminar corium increase in size, they cannot extend or expand because they are present between walls, lamini, epidermal lamini. So when they cannot increase in size, what happens? They may collapse and get necrotic. And when this dermal lamini or laminar corium gets necrotic, they start now to separate from the epidermal lamini. And when they separate, this is laminitis. When they separate, what will happen? Let us look here at this sagittal section. This is the Hoof. We make it sagittal section. Okay. So we can see here B3. We can see the navicular bone. We can see B2. We can see B1. Okay. And what we want to mention here that this is a stratum medium. Okay, with pigmented and non-pigmented parts. Where is the stratum externum? If the camera can get close, can you see this part? This part only is the stratum externum or preopel. This part. So deep to the preopel, here we have the preopelic corium. Deep to the stratum medium, we have here the coronary corium, where there is coronary groove here and the preopelic groove here. Okay? And this is stratum medium. Where is the stratum internum? Is this a stratum internum? Yes and no. What do you mean by this? Because here in this area, this is a mix from the stratum internum and the dermal corium. The dermal lamini, sorry, or corial lamini, or laminar corium. They interdigitate. We can't separate them from each other here. Then we have here B3, the periosteum of P3. So the laminar corium is attached to the periosteum of P3. When they separate from each other, now the B3 is attached to the DDF. Here is the DDF tendon. You see, here is the SDF. This one is the SDF. This is the DDF. And this is a suspensory ligament. Okay, let us follow each one of them. Let us start, and what is this one? This is the metacarpus or metatarsus. Okay, we don't care which one. But let us start with this suspensory ligament. We will follow it. Okay, it ends here. I can see the termination of it. Why? Because it branches into the extensor branches of suspensory ligament. That's why you will not be able to see it. If you see it in the fresh state, the whole limb, it divides into the extensor branches of suspensory ligament. So here we can see it's a continuation. Functionally, it will continue by the oblique and the straight sesamoidian ligaments. Again, suspensory ligament or interosseous medius muscle. Then we have here, this is the proximal sesamoid, and this is called the proximal scutum. You are not required to know this. And here is the SCDF and DDF. Let us go for the DDF, and here in this region we can find the manica flexoria. If I remove the DDF like this, can you see this part? This is supposed to be like a sleeve around the DDF. This is a sleeve from the SCDF around the DDF. This is the manica flexoria. Okay? When we cut it sagittally, we cut part of the manica flexoria. The manica flexoria is a sleeve from the SCDF around the DDF at the fetlock joint. then the DDF will continue. The SDF will end in B2. The DDF will continue all the way down. All of this is still DDF, okay, and it will end here at B3. This is DDF, deep distal flexor tendon, and this is the navicular bone. What is this space between the navicular bone and the DDF? This is the navicular bursa. Okay, this is the navicular bursa, and this navicular bone has this ligament. Here is the lumbar ligament. This small part. This part is the lumbar ligament. Lumbar means the single ligament, and this part is the suspensory ligament of the distal sesamoid or the navicular. Okay. And this is the T ligament. You are not required to know it. Between B2 and the DDF. This is called the T ligament. You are not required to know this one. So again, here is the DDF and this is the lumbar ligament. And what is this space? Navicular bursa. Sometimes inflamed navicular bursitis. I want you to notice first, what is this part? This is the frog. Correct? Can you correlate the termination of the DDF in B3 to the frog? Yes. Almost at the apex of the frog, we have the termination of the DDF. Can you see it? And it's here. So if you have a nail from outside, go through the frog, the center of the frog, for example, it will pass through the frog, then it will pass through the frog corium, then it will pass through the digital cushion. This part is called the digital cushion. Okay, this part is called the digital cushion. Then it will pass through the DDF. Then it will pass through the navicular bursa. Then it will pass through the long nail. Okay, from here and going inside the navicular bursa. Then we will be in the fetlock joint. Okay, so back to laminitis. When this wall separate from the epidermal laminae separate from the laminar corium, the DDF will start to flex and move and rotate B3 into the sole. And this pointed part can now penetrate the sole. Okay? So normally the parietal surface of B3 should be parallel to this wall. Can you see how parallel they are? If there is laminitis, this will rotate and you will find this space now enlarges distally because it starts to rotate. So again, before we continue the hoof, we have here some sesamoidean ligaments. The sesamoidean ligaments are divided into 3 groups based on, we speak about the proximal sesamoids. Their ligaments are divided into 3 groups. The first group, proximal to the sesamoids, we name them proximal sesamoidean ligaments, which are represented by this suspensory ligament or interosseous medius muscle. Then we have middle sesamoidean ligaments. You are not required to know them. They are called short sesamoidean ligaments, and these 2 sesamoid bones connected together by intersesamoidean ligament. And you have distal sesamoidean ligaments. You are required to know them. The distal sesamoidean ligaments are arranged in 3 layers from outside to inside. We have a straight sesamoidean ligament. This one is the straight sesamoidean ligaments which extend from the proximal sesamoid up to B2 here. Then we have the oblique sesamoidean ligament and we have the cruciate sesamoidean ligament. So they are based on their shape, we name them IVX. The oblique is V shape and the X is the cruciate and the I is the superficial or the straight. The I and the X and the V or the cruciate and the oblique, both of them ends in B2. The only one ends in P1. The only one ends in P2 is the straight sesamoidean ligament. The only one ends in P2 is the straight sesamoidean ligament, which is the most superficial. So we name it straight or superficial. Okay. Also, since we are here, this is the fetlock joint. The proximal sesamoids articulate with the metacarpus or metatarsus. Okay. I want you to notice that this is the joint cavity. This is a synovial sac. Notice how it sends the pouch proximally. You see where my finger is? This is the dorso, because this is dorsal, proximal pouch of the fetlock joint. And we have also palmar or plantar proximal pouch. And there is a distal pouch as well, proximal, dorsally and plantarly, but these are the sites which we inject the fetlock joint. Okay? So this is for these parts. I think we covered most of it. Okay. Just for the